Good day, beautiful people. This is Jaquel Wimbush of Ladybug Natural Solutions and the host of Back to the Basics of Health and Wellness podcast. On today's podcast, we are going to talk about high blood pressure. Let's get into it. If it's white, don't eat it. White sugar, white flour, white milk, white rice, white salt, these are all killers. Dr. Layla, Africa, peace be upon his soul.
Daddy, it's time to start your podcast.
Let's talk about that old high blood pressure. Let's talk about it. So, what is high blood pressure? High blood pressure or hypertension occurs when your blood pressure increases to unhealthy levels. Your blood pressure measurements take into account how much blood is passing through your blood vessels and the amount of resistance the blood meets while the heart is pumping. Narrow arteries increase the resistance, and the narrower the the narrower the arteries are, the higher your blood pressure will be. Over the long term, increased blood pressure can cause health issues, including heart disease. The sad thing is, hypertension is quite common. In fact, since the guidelines have recently changed, it's expected that nearly half of American adults will now be diagnosed with this condition. Hypertension typically develops over the course of several years, but it usually don't you don't notice it or any symptoms. But even without symptoms, high blood pressure can cause damage to your blood vessels and organs, especially the brain, the heart, the eyes, and the kidneys. As we know with anything, early detection is important. So, regular blood pressure readings can help you and your doctor notice any changes. So if you have a cuff at home, check your blood pressure regularly. If you go to Walmart, CVS, or any pharmacy, they normally have the cuff there that you can check your blood pressure and just to see what your numbers are, and stay on top of those, because they can quickly change. They can quickly change depending on what you're putting in your body. And if your blood pressure is elevated, your doctor may have you check your blood pressure over a few weeks to see if the numbers stay elevated or fall back to normal levels, which we want. If you do start to have that spike, we want those numbers to come down. The treatment for hypertension includes both prescription medication and healthy lifestyle change, which at Ladybug Natural Solutions, we pride ourselves on making a healthy lifestyle change that lasts. If the conditions isn't treated, it can lead to health issues, including heart attack and stroke, which I know your families do not want in their lives at this point, dealing with all the stuff that we're dealing with these days with the coronavirus. A heart attack or stroke would not be ideal for your family at this time. What are the symptoms of hypertension? So, somebody with severe hypertension, those things can include headaches, shortness of breath, nosebleeds, flushing, dizziness, chest pains, visual changes, blood in the urine. And these symptoms require immediate medical attention. They don't occur in everyone with hypertension, but waiting for a symptom of this condition to appear could also be fatal. So make sure you guys are checking your blood pressure on a regular basis, and keeping your doctor or your health coach or your health professional abreast of the situation while you may be feeling these symptoms. Hopefully you're not. This is another reason why I stress the importance of getting your yearly physical. I put up on my Facebook page. If you're not following me not by now, I'm at Ladybug Natural Solutions on Instagram and Facebook, and I put out a challenge for men to get their yearly physical, because most of the time we're more at risk for these things. So I like to challenge the men to get those yearly physicals, and you know, just to stop the cycle. Stop the cycle, stop it where it's at, so we can live more healthier lifestyles. We need that in our community. For example, if you have a family history of heart disease or have risk factors for developing the condition, your doctor may recommend that you have your blood pressure checked twice a year. But if you have the cuff, you could check that weekly or daily if your blood pressure is spiked. So don't wait until the last minute, folks. As we sometimes do, a lot of people like to wait to the last minute to get their health in order when we feel things, we see things that we need to address, but we like to push them off. But contrary to that, it's like if you see an outfit, if you see sneakers, or if you see something materialistic, you're quick to get the information for that. You're quick to break that down and see how much it will cost. But when it comes to our health, it's like it just goes to the wayside. And then, but that right there, that should be turned around. Your health should be more important than what you're putting on the outside of your skin. What's going on in your skin should be top priority at every day, every step of your life. Okay, so just make sure y'all stay on top of that. So there are two types of hypertension. One, you have primary hypertension. Primary hypertension is also called essential hypertension. This kind of hypertension develops over time with no identifiable causes. Most people have these types of high blood pressure more than often. And some people may say the factors include, the genes, the physical changes, the environment, and things like that. The other one is secondary hypertension. Secondary hypertension often occurs quickly and can become more severe than primary hypertension. And several conditions that may cause secondary hypertension include kidney disease, obstructive sleep apnea, congenital heart defects, a problem with your thyroid, side effects of medication, use of illegal drugs. A lot of people smoking that weed, man. That weed that could spike your blood pressure. That could spike the blood pressure. Alcohol abuse or chronic use, adrenal gland problems, and certain endocrine tumors. So look out for those things, as those are some potential causes and conditions of secondary hypertension. And now I want to talk about how to understand your high blood pressure readings. So you have two numbers that create a blood pressure reading. You have the systolic pressure, which is the first or the top number, and it indicates the pressure in your arteries when your heart beats and pumps out blood. And the diastolic pressure, this is the second or the bottom number. It's the reading of the pressure in your arteries between beats of your heart. So I want to go over the 5 categories that define a blood pressure reading for adults. So a healthy reading is a blood pressure reading that is less than 120 over 80. Elevated is the systolic number in between which is the top number, which is between 120 and 129. And the diastolic number is less than 80. Stage 1 hypertension, that's the systolic number that is between 130 and 139, or the diastolic number is between 80 and 89. And let's go to stage 2 hypertension. That's the systolic number that is 140 or higher, or the diastolic number that is 90 or higher. And let's go into the hypertensive crisis. That's the systolic number that is over 180, or the diastolic number that is over 120. Blood pressure in that range requires urgent medical attention. So, you might feel chest pain, you might have a headache, shortness of breath, visual changes occur. And that's when the blood pressure is very, very high, and medical care in the emergency room is needed at that time. So, guys, don't wait. Don't wait until you feel these symptoms. Make sure you go out there, do your due diligence to get your heart checked at all times. Like I say all the time, treat this like boxing, man. You got to protect yourself at all times. You have to protect yourself, guys. When you are looking to check your numbers at home or by yourself, make sure you get a cuff that fits, number one. For myself, I have pretty huge arms, and a regular cuff will tell me that I have high blood pressure. A large cuff will tell me I have normal blood pressure. So when you go to the doctor, just don't let them put any cuff on your arm. Make sure it's the right cuff for you, and make sure it fits properly. Blood pressure readings, they're different for children and teenagers. Ask your child's doctor for the healthy ranges for your child. If your child is asked to monitor their blood, so just make sure you know ask the right questions. Don't be afraid to ask the doctor questions. I know they're in and out of the office, but just make sure you ask the right questions. So we already know about doctors prescribing different medications, like calcium channel blockers and ACE inhibitors and diuretics and beta blockers and things like such. But let's, as a holistic wellness professional myself, let's talk about the home remedies for high blood pressure. So, healthy lifestyle changes can and will help you control the factors that cause hypertension. And here are some of those most common remedies. So, number one, making that lifestyle change that lasts is developing a healthy diet. So a healthy diet emphasizes foods that include fruit, vegetables, whole grains, and lean proteins like fish. Also make sure you're getting enough fiber in your diet. Don't concentrate on so much of the protein. Concentrate on the fiber, things that are making, the bowels move, to get all of that bad stuff out of there, to clean the kidneys, to clean the arteries up. Get foods with a lot of fiber in them. Fruits, vegetables, water, all of that stuff consists of water. So that's going to help push those things out. And the fiber is going to be the carrier that helps that as well. Increasing your physical activity. A lot of people say, I don't have time to work out. I beg to differ. I think you do. I think you have at least 5 minutes in your day. You have to put down the phone. You have to turn the remote control, turn the TV off. If you're going to put the TV on these days, a lot of people got smart TVs or Fire Sticks in their home. Put on YouTube. Look up a 5-minute workout to increase the heart rate. Just a little bit of cardio. A little bit of cardio. That it'll do so much for your body. It'll make your body good. You know, Also exercise can help reduce the stress, lower the blood pressure naturally, and strengthen your cardiovascular system. You know, you want to aim for 150 minutes, but if you could only get a half an hour in, that's good. But try to get that in 5 times per week. 5 times per week. 30 minutes 5 times per week, guys. That's not asking a lot. Your body treats you well. It wakes you up every day. It helps you. It thinks for you. It does a lot for you. Give that exercise back to your body. And the next thing is reaching a healthy weight. If you are overweight or obese, losing weight through a heart healthy diet and increased physical activity can help lower your blood pressure. Managing your stress. Exercise is a great way to manage stress, like I just talked about. The other activities that could be helpful with that is meditation, something that I do on the podcast, something I do on my Facebook page. Deep breathing, another thing that I do on my Facebook page. I do lives on my Facebook page. A massage, relaxation, yoga or Tai Chi. You, I put up one yoga video so far on Facebook, but I will start putting up more because we need to start looking into yoga because it's powerful. These, all of those things I just talked about are all proven stress reducing techniques. Getting adequate sleep can also reduce stress levels as well to help combat the high blood pressure. And last but not least, I would like to talk about adopting a cleaner lifestyle. If you're a smoker, please try to quit. The chemicals in the tobacco smoke damages the body tissues and hardens blood vessels. Why would you want to put that in your body? Why? Why, I ask? If you need help with smoking, give me a call. 201-888-4706. We'll talk about it. If you need help with lowering the blood pressure, give me a call. If you need help losing weight, give me a call. If you need help autoimmune diseases, I'm specialized in autoimmune diseases, give me a call. Ladies, if you're having issues with hormonal balancing, give me a call. I'm certified in all of these things. So I'm here for you. I wish you all well through your lifestyle transitions. And at the end of the day, let's make that lifestyle change that lasts. Hey guys, I want to like to thank you all for joining me today on today's episode. If you have any questions or concerns, please drop them in the comment box on my Facebook page or on this podcast, and I will answer them for you. And if you need extra help, I'm here for you. My number is 201-888-4706. Guys, I would like to thank you again for listening to today's podcast. Enjoy, be well, and make that lifestyle change that lasts. Have a great one, everyone. Talk to you soon.